I'm joined now by Dr. Julia Indik, who is the Scientific and Clinical Documents Committee Chair. Thank you for being here.
Thank you.
So first tell us what the committee does exactly.
Oh, wow. So it's a mouthful, the Scientific and Clinical Documents Committee. But, our main job is to shepherd documents through the Heart Rhythm Society. And that comes in two ways. First are the documents that HRS leads. And we lead and either partner with another society or invite other societies to collaborate with us to create a document. In fact, I'm just coming now from the presentation of our HRS consensus statement on magnetic resonance imaging and radiation exposure for patients with cardiac implantable electronic devices. So that's what we do at this meeting. We present our new documents for which the SCDC has shepherded the way to create that document.
You must get so many of them. How do you go about curating the documents that will actually be presented here at the meeting?
Well, so actually it's a more complicated answer than that. So let me first start with how we figure out what documents to do. So that comes from ideas that come from the HRS membership that come to us, as well as document topics from our committee. And we put together where we think the needs are for our membership to understand how to manage patients. And in terms of which then documents get highlighted at the meeting, it's our documents that are ready for presentation or have been published within the last, say, couple of months of the meeting. We have a rolling process of documents throughout the year, but by and large, for the most part, all of the documents will be presented here.
Do you have advice for people who want to try to submit to enhance their chances?
Oh, just contact HRS at the website. We would love to hear from you. We want to engage our volunteers as much as we can. Who wants to be serving on committees? Who wants to be part of the programs? Who wants to contribute ideas? We encourage that very, very much.
So what do you hope the recommendations will achieve?
So it's really the hope of the Heart Rhythm Society that the consensus statements and the recommendations that they involve will give guidance to physicians on how to manage patients using best evidence to underpin those recommendations.
And what about documents from other societies? How do they fit in?
So part of our charge of the SCDC committee is to review documents that are led by other societies, where the Heart Rhythm Society might be a collaborating society to that document, or an entirely external document where that society is coming to the Heart Rhythm Society to request our endorsement. So the SCDC carefully reviews all of those documents to determine if it's in keeping with our interpretation of evidence and what we think might be best practices for our physicians as part of the Heart Rhythm Society before assessing for endorsement.
You're doing a big job and a big title, Dr.
Oh,
Indik. Thank you.
It's a joy, I have to tell you. Yeah.